Friends, this is Pastor George Nicholas, and you are tuned into the Igniting Hope podcast. We're here at the Buffalo Center for Health Equity, located on the campus of Canisius University, right in the heart of our neighborhood, the east side of Buffalo, as people would say, Hamlin Park. We're right in the middle of it. And today we want to have a conversation with you about how we can make sure that we better care for one another. There are institutions and organizations in Western New York that are really dedicated to caring for everybody. You know, we here at the Buffalo Center for Health Equity, it's our mission to eliminate race-based health disparities. We don't believe that your ethnicity nor your location, what neighborhood you live in, should be the defining factor of your health outcomes. We've done work. You go onto our website, buffalohealthequity.org, buffalohealthequity.org, and you'll see different reports, different studies that we've done, studies that the Erie County Office of Health Disparities, Health Equity has done, that document that if you're African American and you live in certain communities, you're going to have higher rates of chronic disease. In some neighborhoods, a 300% higher rate of chronic disease than if you were white living outside of that community. And that could transfer to 10 to 12 less years of life. We're talking about diabetes, hypertension, heart disease. And those things can be better controlled if we address the social determinants of health, the lived environment. What happens inside the healthcare system is important. What happens outside the healthcare system as it relates to your lived environment plays a bigger role in your health outcomes. We here at the Buffalo Center for Health Equity have landed on 5 things that we believe once we address those things and we work on them collectively, then we can improve the health outcomes in our community. We want to make sure that every child is reading at grade level. We have a tremendous problem with illiteracy for our children. 2, we want to make sure that everyone has access to working at their highest capacity, that they have attained the highest levels of skills and they have access to employment that's going to pay them a living wage and beyond a living wage. We want to make sure that everybody in our community has access to quality, affordable housing. We want to make sure that everyone has access to healthy, affordable food. And finally, we want to make sure that everybody has access to good, culturally competent primary care. And they're connected, so I don't want you to think of them, don't look at it in 1, 2, 3, 4, 5, but look at them as they come together. If you're struggling with your education, it's going to be difficult for you to get a better job. If it's difficult for you to get a better job, it's going to be difficult for you to buy a better home. If you don't have the money, it's going to be hard for you to live in a neighborhood that has access to good grocery stores. And even if the grocery store is located right around the corner, if you don't have the money to buy healthy food, then it's a problem. And then primary care, you know, we want to make sure that there's a connection, that you get to the place where you can get the quality primary care that you and your family needs. So to that end, and we're going to be working on that through our multi-sector collaborative, through our Ignite Your Hope work, and you'll hear more about that in the future. To that end, you know, the Buffalo Center for Health Equity, we work with partners, right? This Lone Ranger mentality that, you know, one agency is going to save and rescue us all. It's a model that's not going to work. And so collaboration is key for us to bring health equity to this region. Today, we're going to have a conversation with, first of all, she's a friend, colleague, Dr. Allana Krolikowski. And she is the newly appointed Chief Executive Officer for the Jericho Road Community Health Center. Jericho Road is, how I describe Jericho Road is, it's the best example of the Church of Acts in this region. And what does that mean? It means that they show love, compassion, and care for every person that walks through that door. They're completely inclusive. There's a level of professionalism. So sometimes we think that if people don't have money, any level of care is better than no care. No, we want to make sure that folks, everybody has the best possible care they can have. And so we partner with Jericho Road Community Health Center on a number of things. And one thing specifically, we'll start our conversation off, Dr. Krolikowski, with the issue of maternal health. And so welcome to the Igniting Hope podcast, my friend. And so we'll just have a conversation about it. So what are you seeing in the maternal health world as it relates to, specifically, we at the Buffalo Center for Health Equity, we're unapologetically advocates for those in the African-American community, not exclusively, but that's our primary focus. So what's going on with African-American women and maternal health and in this area, and what are we going to do about it?
Well, thank you, Pastor George, for having me today and for speaking so highly of Jericho Road. We appreciate that. Well, I mean, I am the CEO of Jericho Road, but I am a family doctor, and I'm a family doctor who delivers babies. Maternal child health has been a passion of mine for a long time. And we know that Black women around this country, around the state, and here in Erie County have worse maternal health outcomes, increased complications, increased maternal mortality compared to white women. And that is regardless of socioeconomic status. And so really the only thing that can be due to is structural racism and lots of other factors. But that when it's regardless of socioeconomic status, it has to be that. I also sit on the Maternal Mortality Review Board for the state of New York. So we, at Jericho Road, we've been providing full spectrum family medicine, including obstetrical care, since we started in 1997. And we believe that providing care to everyone, regardless of their ability to pay, regardless of what you look like, whatever your zip code is, like that's what we're here for. And we know that comprehensive integrated care can improve health outcomes. So one of the things that we noticed at Jericho Road, and I think for a long time we've been seen as a refugee and immigrant place, and people believe that that's who we care for. And so the majority of women that we deliver every year are from the refugee and immigrant community. But we have 2 locations on the east side of Buffalo, intentionally, one at 21 Dote and the other at 1021 Broadway. And specifically at our 21 Dote office, we have a predominantly African-American team that reflects the community, intentional.
Who's on that team? So, because people need to know. I mean, these are real folks.
Takesha,
and speak a little. I can't hear so well, so if you can speak. No, just speak up. You're all right. Go ahead.
So Takesha Leonard is our medical director of that site. She's also our chief of clinical services.
And also a board member of the Buffalo Center for Health Equity.
A board member for Buffalo Center for Health Equity. She has a lot of letters after her name.
Yes.
Family nurse practitioner, psychiatric nurse practitioner, and has her doctorate in education. And then, so she leads that site and provides primary care, behavioral health care, because she has a psychiatric NP as well. We have Dr. Demetra McElwain, who is a family physician who does obstetrics as part of her practice, and she grew up in the neighborhood. She is an absolute success story of someone who wanted to be a doctor, became a doctor, and wanted to be a doctor for her community.
So these are both African-American women?
Yes.
Okay.
Yep. And Jolanda Montgomery is our director of behavioral health. She is an LMHC, licensed mental health counselor, and she sees patients at the Dote and Broadway locations. And Siobhan is our nurse manager. She grew up in the neighborhood. Mm-hmm. And we now, through the project that we're doing with the Buffalo Center for Health Equity, funded by the Health Foundation for Western and Central New York, have a maternal health ambassador on staff, Shiree.
Yeah, so let's talk a little bit about that. Yeah.
Everyone is African American that I mentioned,
yes.
Really with the intention that we care for the community in a culturally responsive way.
And so not only are they, I mean, so they weren't hired because they're African American, but they're very highly qualified, highly skilled professionals.
Yes.
Who, by choice, have chosen to serve in this community.
Yes.
And Jericho Road is honoring that choice by employing them, empowering them, giving them roles of leadership, and basically making that connection. Now, one of the things and that's very, very important. It's very important. You know, there's Harriet Washington's book, Medical Apartheid, talks about how, African Americans can be not treated so well inside the healthcare system. Sadly, some African American doctors also have inherited the bias because they go through the medical training of our medical schools and they live in the societies that we live in. Yeah. But there is some data that shows that when they're healthcare providers that have shared cultural experiences or come from same shared backgrounds, that there's a better connection in that process. And so one of the things let's talk about this grant, because a great partner, the Health Foundation of Western and Central New York, has been a great supporter of the Buffalo Center for Health Equity, and I know they've supported Jericho Road over the years. And now we're doing a project together. So what specifically are we trying to accomplish in this project?
So this project, really the goal is to determine how can we advance maternal health equity for African American women, specifically on the east side of Buffalo, with a host of integrated services: primary care, preventive care, behavioral health, community health worker services, doula services, and community engagement. So Buffalo Center for Health Equity has a community engagement ambassador who I think is starting soon.
Yeah, well, she'll be starting. She'll be starting, I think, on the 18th. I think it is.
So that's exciting.
Yes.
And really, the goal is to, through this, educate the community, to empower the community, and you don't have to get your care at Jericho. We're open. Our doors are open. We'd love to take care of you, but also to empower people to know what their choices are, how to advocate for themselves, and how to go through that process to get preconception care before you even get pregnant, to ensure you're having early access to prenatal care, that we know that those things help improve your outcomes of your pregnancy, and ideally to have a team that looks like you. And I know there's other people in the community doing this work, Dr. Sosa and others.
Yes.
And so, again...
But we're all partners in this work.
We're all working together.
We're all working together on this. There's no competition here, right?
Absolutely, no.
Because in order to solve these problems, all of us, we got to work together. So I didn't mean, just wanted to...
No, that's okay. Yeah, no, I work with her at Children's Hospital.
Yeah, she's fantastic.
Yeah, so I know that there's a lot of people trying to do this, and so how do we make sure the community is educated about what their options are, and get connected to the resources and services they need to improve health outcomes. So
one of the reasons why we have this grant and we're having ambassadors, because we have capacity. So we're going to share a little bit about, there's capacity, there's room. If you're out here and you're pregnant and you need prenatal care, whatever the care you're going to need, doula services, if you need the care, there's room for you here. Can you explain a little bit about that?
Yeah, we have space. We have space to take patients. We have access. We're going to talk about access. Yeah. And to invite people into this program where they can receive a host of services. So primary care, maternity care, behavioral health if needed, doula services.
So Jericho Road is a federally qualified health center. So what does that mean in terms of who can come?
So federally qualified health centers in this country are regulated. We are required to take anyone, regardless of your ability to pay.
So you guys hear that? So, if you have insurance, you can come. If you got Medicaid, you can come. If you don't have Medicaid, if you don't have insurance, you can come, right? The issue is if you need care, you cannot say there's no one that will care for you, because we're here for you. Jericho Road, right there. And where's it located? This clinic we're talking just about maternal health. Now that thing's the notion of being anybody can comes for any kind of sickness, but we're talking about focus on maternal health. In this site where you have 4 or 5 black women, professional black women with credentials, with experience, but most importantly, a heart for you, right? They're waiting for it. They're waiting for you to come through those doors so they can wrap their arms around you and make sure that you have the best possible birth outcome that can happen. So how do folks get connected there?
So
what's the location again?
21 Dote.
21 Dote Street.
Dote in Genesee.
Right.
Dr. McElwain also sees patients at 1021 Broadway one morning a week, so
Right.
that's closer. She could
Right by the Broadway Market.
right next to the Broadway Market. Yeah, so she could. See
There's
people
bus
there.
line there, right?
There is.
Right.
Yeah.
Does Jericho Road provide transportation?
We don't provide transportation directly, but if you do have Medicaid, we
Get a Medicaid
need
cab.
support. You could get Medicaid tax.
So you can get there.
Yes.
Go ahead. No, this is important because a lot of times,
Yeah.
Dr. Krolikowski, folks will come and they'll just talk of their deficits. I can't get there. I don't have money. I don't have, and I'm not nobody's mad at you, but it's our responsibility. That's why we're hiring. We are hiring staff just to go out and to talk to you and to let you know that these services that's their sole job, is to let folks know that these services are available to you and how you can get connected to those services.
Yeah, absolutely. And I mean, for people who have they need extra support. I mean, that's what Shiree's there for too, is to help provide some of that wraparound support, make sure you get connected and navigated to services either internally that we have or external services. She's also a certified lactation counselor, so that's pretty amazing to have that breastfeeding support right on site. We have another nurse practitioner at our Dote Street office, Heidi Nowak. She's not African American, but she grew up near Bailey. She grew up on the east side, and she is a women's health nurse practitioner, family nurse practitioner, and certified lactation counselor as well at the 21 Dote office.
So prenatal?
Yes. Prenatal.
Right. The birthing process, right? What's that? What natal is that called?
That's intrapartum.
Intrapartum, okay. And then postpartum. Now, why is I'm going somewhere with this. Women are, I don't know if it's at most risk, I don't know what the stats are, high risk for depression, suicide, being victim of domestic violence, postpartum. You want to talk a little bit about that?
Yeah, so the most common causes of death postpartum in the first year after giving birth are mental health related or hypertensive disorders of pregnancy, so high blood pressure that appears after pregnancy. And domestic violence, we know, increases in pregnancy. So people who are pregnant, immediately postpartum, new children in the house, there's higher rates of domestic violence.
So we have services available for you. You do not have to suffer alone. And so that's why this kind of wraparound, comprehensive, culturally competent, high level of medical. I mean, the folks at Jericho Road, they could work at any hospital. They could work at it. Don't get it twisted that sometimes people think that, well, the doctors out at whatever place out in Orchard Park somewhere are better physicians than the folks at Jericho Road. That's just not true. That's all I can tell you. It's just not true. It's just certain people have chosen to take different paths on their professional journey, and some have chosen to serve. I mean, these people aren't volunteers; they get paid, but they've chosen to practice their profession in communities where, quite frankly, I think they're needed the most. And so I think that's commendable. And I mean, this is purely not scientific. many years ago, I used to be CEO of the Geneva B. Scruggs Community Health Center,
Great.
right?
I forgot
And
about
we had like 20,000 patients. It was wild. And I got to tell you that not every doctor can handle that, right? And so I would argue that a doctor that can function at a high level at a Jericho Road could function at a high level anywhere.
Yes, I would agree. Yeah.
But I don't think the converse is true,
That's also true.
right? So a doctor that may be very successful in a practice where everybody's, got a little money and it's calm or whatever it is, they got the nice music playing when you go in the weight room, all that kind of stuff. That doctor may not be able to keep up, right? Because talk a little bit about the patients at Jericho Road and what the patient brings into that medical room.
Yeah. Yeah.
That may be a little different.
Sure. I mean, I think that the community health center movement around the country really is committed to caring for the most vulnerable wherever they are. Obviously, at Jericho Road, we do that. We're faith driven. We're driven and called to this work by our faith. But all community health centers are feel this mission to care for people, irregardless of what struggles they're facing. And people are facing a lot of struggles because of the way that our society has developed the systems to be this way. So we talk about the social determinants of health, health-related social needs. Those are driven by the political determinants of health, by how we vote, who's in government, what policies are made, and all of that then shapes these systems and structures that lead to all the inequities that we see. And so when someone comes into my exam room, there's all of that that's surrounding them. And I may not be able to just do one thing and then they can go get it because they have all the means to drive all over the place. And if they don't have transportation, if they're having unstable housing, I mean, all the things you already talked about, or what's their access to food. And we see all of this that people are struggling with, and so you're handling all of that in the exam room, and that's why community health centers have also developed to have this sort of comprehensive set of services. So we have a patient navigator team that helps people who need help connecting to different specialist appointments if they're struggling with that, or how do we help figure out how to arrange transportation for you. Like I said, we don't provide it directly, but are there ways that we can support that? We have a care management team that has a health home program for people with much more complex chronic health issues, and people are bringing a lot of trauma into they've experienced a lot of trauma in their life.
So, with that being said, and one of the concepts that we talk about a lot is weathering, and how dealing with systemic racism and other forms of discrimination and oppression that certain people have to endure here in this republic, that impacts your health, right? It breaks down your cells. It makes you, I mean, it's proven, right? And so with that being said, now this is a federally qualified healthcare center, federal. So the money comes from the federal government. Now, let me clarify this, right? Right. This is the 330 grant. They still call it the 330 grant now?
Oh, the 330.
Yeah. So
hasn't changed.
No. The amount probably hasn't changed that much either.
Nope.
But when we talk about federal dollars, first of all, federal dollars are our dollars. So politicians, Congress members, senators, presidents, that is not their money. It's our money, right? And so, can you talk a little bit about the commitment that the federal government, with our dollars, how is that commitment matching the need? And if not, I know the answer to these questions, but how do we impact that? So give me a little sense on why important. So let's start with why federally qualified health centers are important in our society.
Sure. So in 1965, this country passed Medicaid and Medicare. There's a good history around that. Well, not good, but you can read the history of why we developed Medicare and Medicaid as separate things. And that's rooted in racism.
Right.
Like why those are even separate the way they are. But that same year, there was funding for 2 demonstration projects, one in Mountain Bayou, Mississippi, and the other one in Boston, Massachusetts. And then 10 years later, they permanently authorized community health centers. So there are, Jericho Road was started as a private family practice. And
who started it? Shout out to the Glicks.
Dr. Myron Glick
yes.
and Joyce Glick started Jericho Road in 1997. And they sacrificed for a really long time because to care for patients, regardless of the ability to pay, without any supplemental resources, is very challenging to do. And we've seen examples here in the city of Buffalo on the east side that have closed, health offices that have closed because they were serving predominantly Medicaid populations and could not afford to keep their doors open.
Right.
And so, we became a health center in 2013, but community health centers have to be in a medically underserved area, population, and so they're all in all types of communities, urban, rural, red states, blue states, red communities, blue communities, and there's strong bipartisan support for the work of community health centers because we are the safety net primary care sort of largest of that. I mean, community health centers care for about 10%, maybe a little bit more than 10% now of Americans. So are really caring for a significant portion of the American population. And
how big is your patient population at Jericho? Yeah.
So we take care of more than 25,000 unique patients every year.
Wow.
And we have primary care, maternity care, behavioral health, pharmacy, we could talk about pharmacy too, dental, physical therapy. We have a fitness center at 1021 Broadway, so you should come to the second floor and work out.
Yes.
Beautiful space there. And then a host of other sort of wraparound services.
You have pediatric care?
We do.
Yep. Mental health?
Yep.
Yeah. So here you go.
40% of our patients are kids. Actually.
Yes. Right. So this is a good thing the federal government's doing, right? So how do we? So what's going on now? Is there continued support, or is there challenges, or let me reframe it. There has been a change in how the federal government is basically relating to humanity. Let's put it that way. How has that impacted the work at Jericho? What are you seeing there?
Yeah, I mean, I think 2 things. One is that this country does not value primary care the way that it should. And estimates, depending on where you are in the country, but Medicare and Medicaid spend somewhere between 3 and 4% of healthcare dollars on primary care, when they should really be spending somewhere between 10 and 12% on primary care of the healthcare dollars. Doing that, investing in that front line of the healthcare system would improve health outcomes and save cost for everyone. And if people think that it doesn't impact them because they're not on Medicaid, they're wrong, because it impacts all of us. We all pay taxes. We all live in this county, and even if you don't live in the city of Buffalo and you live in Erie County, like the county is paying for a lot of things that the way the city and the county work together.
So if the Medicaid reimbursement from the state,
Medicaid reimbursement,
so if the Medicaid reimbursement rate is not increased, in the state. What impact does that have?
Right. So yeah.
So what's the difference there?
The state of New York has not reformed the rates for community health centers in like 30 years.
30 years.
Yeah.
So it's
We've had, like,
has
tiny increases,
right.
but nothing that reflects what it actually means to pay your staff.
Mm-hmm.
And then the federal government's changes in Medicaid. Jericho Road has a very high percentage of patients with Medicaid, although we take care of everyone, and we're happy to see you whether you have private insurance and
mm-hmm.
uninsured, Medicare, it doesn't matter. But because of the changes to Medicaid at the federal level, we will see reduced revenue in the coming year and a half.
So, but have you seen a reduction in need?
No, it'll actually get worse.
Right. So there's needs for people for this care, right? Federal government has made an investment. Now they're going to reduce that investment.
Mm-hmm. I don't really know what they're thinking, to be honest. I think there's this rhetoric out there saying that people are frauding the system, and there might be a very tiny percentage of people who are.
So how would you? So walk me through that. So, what would be the financial incentive for an individual to try to fraud Jericho Road? What could they get?
Not to fraud us, but
But you're the ones that provided it, right?
Yeah,
like,
I think
what kind of scheme could somebody do to get their hands on somebody from Jericho Road, some federal money?
Yeah, no, I don't know. I think it's what people are saying that when they're saying that there's Medicaid fraud, there
Right.
might be a small number of people who really don't qualify for Medicaid but are still on Medicaid, and.
But where
The person in that category probably they might be just above the threshold, and they can't afford how expensive healthcare is in this country. But when people become uninsured, that is just bad for everyone.
Right. Okay.
Yeah.
But isn't it true that most of these cases of Medicaid fraud have been perpetrated by private doctor firms that guys?
Well, especially Medicare fraud.
Yeah.
Yeah, and that's there's really more money in Medicare than there is in Medicaid. So yes, a lot of.
So it's not the people.
It's not the people. It's not the people.
But it's the people that are going to be hurt if we cut the money from the program.
Well, right. Yeah, and it's the people who are working 2 and 3 jobs and still struggling.
Wow. So we got to do better.
We have to.
We got to do better. So, and you're tuned in to the Igniting Hope podcast, and we're gonna just have one more question, one more little segment here, and we have Dr. Allana Krolikowski, who is the CEO of the Jericho Road Community Health Center. What's the phone number at Jericho Road? If somebody wants to get in contact, how do you?
Our number is 716-881-6191.
Okay, so, and I'm sure you got a website or other, but if you need help, call this number. What's the number again?
716-881-6191.
Right. So, and this is really, and I really want to speak to those who are African American, live on the east side of Buffalo. There is a need for more access to primary care and all kinds of healthcare services. Jericho Road is not just for refugees. It's not just for people who live on the west side. It's not just for immigrants and all this other stuff. They care for that population, right? But they're going to care for you as well. They're on the east side, 1021 Broadway Street,
21 Doe.
21 Dote Street, right? That's east side, Genesee, Broadway, Fillmore area, okay? So those services are available to you. So please, my friends, let's take advantage of that. So in our final segment, I want to talk a little bit about access to primary care. So we're Jericho Road and the Buffalo Center for Health Equity, we're partnering, collaborating on maternal health services, increasing access, letting people know that these services are available for you to help do that. We're also going to partner together. We talked about our 5 areas of focus. One of those things is primary care. So how do we increase or enhance access to primary care for those in our community? What are some of the things that you just in your thought process you think we need to do as a community?
So we can talk about local community, and then I think there's some sort of bigger policies that even locally we could advocate for to really try to push the system in a better way. I mean, locally, one is if you don't have a primary care provider, look for one.
Okay.
You know, there are 4 FQHCs in the city of Buffalo. So Jericho Road, Community Health Center Buffalo, Neighborhood Health Center, and Evergreen might be a lookalike, but all in the city of Buffalo, open to new patients, and I would be happy to see you if you don't have someone that you go to for primary care. And then really we need people to see the value in having the continuity in that relationship. We know that if you have continuity, so even before you get sick, but then also once you do, if you have diabetes, if you have high blood pressure, you may not even know you have those things. But then once you do, if you have continuity, you are more likely to not have to go to the hospital, and you'll have a better experience long term if you see the same person over and over. And it just helps you save money too. I mean, especially if people who have private insurance or they get on Medicare eventually, and then they have all these costs for their pharmaceuticals. Like this, just think about how this impacts people, and having access to primary care keeps people healthier longer.
So we're going to be working together. One of the things we're going to be establishing is a multi-sector collaborative. We're going to bring together those who provide care, like Jericho Road, business leaders, one of our funders, Highmark, other partners that we're going to bring in, the University, Erie County Office of Health Equity, all these different, and we're going to solve these problems, right? I refuse to believe. Did you see that Artemis 2, right? So you see these humans can do amazing things, Allana. I mean, we can do amazing things, right? And so you cannot tell me, you're not, but I'm just saying, Joe, you cannot tell me that we cannot create a community of care where everyone has access to a healthy, prosperous life. We can do that.
Yes, we should be
right?
able to.
If we could take a rocket ship and shoot it past the moon, and then bring the people back safely, right? That teaches us that the human mind, the capacity of the human mind, can do what others might think are unthinkable. But when you have the capacity of the human mind determined, focused, resourced to solve a problem, the problem can be solved. That same kind of thought process we have to apply to bringing health equity, right? And so that's our appeal. That's why we're trying to build. That's why we're trying to build these kind of collaboratives to solve these problems. It's the solution to hunger is not more food pantries, right? We have to start creating this equitable community of care, right? That's devoid of not only economic inequalities, but of racial inequalities, systemic racism, right? Which is real. It's real in this republic, and we have failed miserably in addressing it. And just talking about it, whatever, that's not addressing it. You know, we have to really have people they call the uncomfortable conversations, whatever. Just have the conversation. I don't care if it's comfortable or uncomfortable, but what's more important is it meaningful, right? Is it meaningful? Does it bear some fruit? Does something change, right? So, in our last comment, describe to me what that kind of community of care looks like for you.
Well, those of you who know Brian Stevenson started the Equal Justice Initiative, and he said the opposite of, what do you say? The opposite of poverty is not wealth. The opposite of poverty is justice. And I mean, we need to embrace as a society what we all deserve, and as far as health goes, that everyone should have access to health care.
That's a human right.
That's a human right.
It's not a constitutional guarantee. Yeah. It's a human right. Yeah. Go ahead.
Yeah, that everyone should have access to care. Everyone should be able to, there's opportunity gaps in who can become a doctor or who can go into certain professions, and those barriers then prevent you from having culturally competent or culturally responsive teams. But a community of care would be that we have health teams that reflect the patient population, that reflect you, and that we are providing what is basic. We should see this as basic as a country, to ensure everyone has access to healthy food, to everything that you said in the beginning. Everyone has access to gainful employment. And the problem is when we don't, for example, give people access to care, to health care, then they get sick, they can't work. That impacts the local economy. I mean, the Office of Health Equity in Erie County has put out a really good report that shows the economic impact of these problems and of these disparities. And so we need to come together and say that this isn't a you problem, like this is an us problem, and that we can all rise together.
Mm-hmm. So thank you so much, Dr. Allana Krolikowski, the new CEO of the Jericho Road Community Health Center. Multiple locations. How many locations you guys got?
We have 6, although 2 of them are inside homeless shelters.
Right,
so
right.
4 primary locations and then 2 inside homeless shelters.
And one located in Sierra Leone?
Well, then we also have health facilities in Sierra Leone, Democratic Republic of Congo, and Nepal.
Right. So
the whole other aspect.
Yeah, that's another part of the company, but it's under kind of the same umbrella, the same mission of caring for all of God's people. And so, and that's why it's easy for us at the Buffalo Center for Health Equity to partner, to come alongside, to support Jericho Road and the work that we are doing together to build this community of care that you all deserve. We all deserve this. So call them. If you need care, you need help, reach out to Jericho Road. When you see our staff out there, our ambassadors out there, talk to them, share with them, and help us build this kind of community of care. So this is Pastor George Nicholas from the Buffalo Center for Health Equity. You've been watching the Igniting Hope podcast. Please know that we do this for one reason, because we love you. Our motivation is not money, it's not fame, it's not adulation. We are driven by our uncompromising love for you. So until next time, we will see you soon.